Yes, I can see it on, oh, here. Yes. Yes, you are good. You are good to go. It is all
All right,
yours.
awesome.
Thank you.
Thank you, Katya. Thanks for having me. Hey, everybody. Thanks for joining today. My name's Chad Sawyer. I'm the VP of Healthcare at Faster Outcomes. Um, Faster Outcomes is an AI platform. We'll talk a little bit about that. But really, today, what I want to do is spend time talking about protocols, the importance of protocols, why you need to have them, how do you go about actually creating and testing those protocols, and then how do we go inside the AI engine to use that to our advantage so that we can scale the clinic. Um, and so today, what we'll do is we'll kind of go through, we'll talk about protocols, we'll talk about trends in elective medicine, where is this going, where are the dollars shifting. Then I want to really spend a lot of time going through the AI shift in modern clinics. Why is AI becoming a clinical advantage? What does the new care model look like? So it's about not just being there, but more personalization to patients, being as precise as possible with creating treatment plans and getting those treatments to the patients. Figure out where clinics are gaining efficiency today. Then we'll go into precision care at scale. How do we take that and how do we do that to a number of patients and do that quickly? Go inside AI, how it can look like in your clinic, how are clinics supporting their patients using AI, and then we'll go into what it looks like actually in your practice. And so the first question, why do you need protocols, right? And if you're on this call and you have protocols, that's great. For those who, maybe have protocols, but they're living in your head, what I want to talk about is why do we need to get that out of your head and what does that look like? So when we're running a clinic, is our goal short-term revenue or are we trying to create long-term value and not just value, where patients are coming back, but potentially setting yourself up to have an exit down the road. People want to invest, you want to grow multiple locations, really get to that next level. Having protocols is going to give you more consistency when providing high quality care to patients. Doesn't matter who a patient's talking to into the practice, every single person needs to be saying the exact same thing, whether that's the founder, those are the providers, the front desk staff, admin, anyone who is being asked about a certain treatment should be saying the same thing. By establishing those protocols, you're going to give yourself the ability to see more patients and not just making your practice more desirable from the outside, but freeing yourself up from spending less time on things that don't really contribute to the patient's outcome or don't contribute to increasing revenue in the clinic. And so opening up more treatment windows within a typical day is something that is going to increase the potential revenue that you can have come in throughout the course of a year. Lead yourself to getting better outcomes, which is going to lend yourself to better reviews, more interest outside, and again, creating scalable growth, right? We want to not just be whoever the main person that's seeing patients, each person who comes into your clinic, each new hire should be able to hit the ground running and take your clinic to the next step. And so where do you where should we consider creating protocols? And if there are things that you do outside of this, that's great. But if you're someone who's either getting into wellness for the first time, or if you're doing a lot of these things, but you're trying to figure out where do you want to specialize in, these are the categories that we seem to see the biggest growth in. And so peptides, huge, which I'm sure everyone's talking about, and more, especially with some of the recent announcements in the last couple of days. Weight loss, GLP-1, we know that's not going anywhere. Hormone replacement therapy, sexual wellness, hair restoration, and IV therapy in some cases. And so once you decide what you're going to do in the clinic and what's going to separate you from all the other practices around you, how do you create those protocols? So the first part is everything needs to be evidence-based. And by that I mean if you want to have protocols that are desirable or that really separate yourself, they can't just be things that you think work. You need to track best practices, create specific standards that you're tracking that up against, and then constantly update based on new research. So having evidence-based protocols is super important. The second part of that is looking at the patients and understanding, okay, what goes into these protocols? What are the ages of the patients that we're treating? What are the conditions, the risk levels, comorbidities, contraindications? You need to, when a patient comes in, know exactly what to do with the patient that's looking at you. And then from there, safety and escalation logic. When do we intervene? When do we alert staff? When to stop? When to adjust care? These are all questions that you need to have answers to, and being able to go back to number one, evidence why when you decide to intervene, why that's correct, when to alert staff, why that's correct. And so it needs to be based on what you're actually doing. And so, how do we turn clinical logic into real world execution? Mapping protocols into daily workflows. First, every staff member needs to be on the same page, from the providers to the front desk, care coordinators, doesn't matter who it is. Time considerations, when these actions need to happen, what are the frequency of these touch points, the duration of care plans, so what looks like in the first 30 days, 60 days, 90 days, 180 days, how depending on how long you want this patient to be in the clinic or have them coming back, that all needs to be mapped out ahead of time. And then you need to have exception handling, right? When missteps happen, when there's non-responsive patients, when there's disruptions to our normally scheduled outcomes, what do we do there? And this can't be a guessing game. We need to have documented protocols that everyone in the clinic knows how to respond to those unexpected situations. So, where does this data live, right? Patient data protection. You need to have audit trails for every action that you're doing in the clinic, managing consents, having integrity of the data, documentation requirements, right? Figuring out where all this information that you have in your clinic that makes your clinic special, how is it used, where are you hiding that, and who can access it are all questions that you also need to ask yourself. So here's the clinical reality, right? It's getting more difficult and more complex to get patients the outcomes that they want. Optimization is harder than ever. Whether you look at peptides, BHRT, weight loss, it's all getting more complex because people are having higher and higher expectations. There's more therapies available. The changes are always happening with what medications we can and cannot use. How do we use them? How do we incorporate that? We have more data. We have more information in the form of labs, biomarkers, tests, which is all super valuable. But every time that you get another test, it's another thing that you have to look at. And so the problem is right now, without having truly set protocols, you can't help but take a little bit of a random approach, which is going to create inconsistencies with how your patients get treated. And so the first prescription doesn't determine outcomes, the optimization strategy does. And so this is how we start to look at how modern clinics are incorporating artificial intelligence. If you combine precision protocols that you create, that you come up with, that you test, pair that with AI, you're going to get more consistent results. And so here's why AI-driven protocols matter when creating customized treatment plans. And treatment plans are something that every clinic should be trying to put together. I know it's time consuming. I know there's a lot of effort that goes into trying to figure out what we have in the clinic, what meets this patient's needs versus what's the clinical reasoning behind that. But if you can do that ahead of time and pair that with AI, you're going to have more structure to that clinical reasoning. Creating playbooks in your practice, right? Allow AI to guide you through a defined workflow, intakes, labs, risk markers, treatment options. When you have all this information, AI can kind of go through it, take the voice that you've created, and get you to a place where the natural next step is to now present to the patient what they can benefit from. Applying this into your practice is going to create that consistency. Doesn't matter what patients coming in, they all have different needs, but no one should have the same treatment plan, or maybe there's some crossover there, but every case needs to be evaluated using the protocols that you've designed, put that into a decision framework, eliminate any variables that come up when using open AI tools with different prompts, and it's all should be built on your practice, right? I can't speak to that more and more. There's no better logic than what you've seen in your own real life. And so you should start now documenting that, figuring out how you're communicating with patients, figuring out those outcomes, figuring out what you're doing, and start creating playbooks within your practice that allow you to put yourself in a position where it doesn't just rely on you speaking to the patients. So AI no longer just an administrative tool. There's a ton of AI, use cases out there, but it's becoming a real clinical and revenue advantage. Creating personalized care, tailoring treatment plans, patient insights, giving yourself more operational efficiency, reducing that administrative bottleneck, higher patient retention, converting more patients from consults into patients. All of this is going to create more revenue opportunities, but it's also going to allow patients to get the best outcome because you're looking at everything that you're doing in the practice in presenting all of that, right? What we see in clinics is a lot of times they have really big treatment menus, but they're only focusing on one or two or maybe three different things because that's what the staff is capable of picking up at that one particular point in time. Creating customized plans is going to allow everything that you've ever invested in the practice, those devices that maybe didn't get a ton of use or whatever, and now figuring out the logic behind it and telling patients why they would benefit. And naturally, you're going to see patients spend more money in your clinic because they're looking to better themselves and they're expecting precision, speed, and clarity. So, what happens if you don't have protocols, right? If you don't take action, if you don't start using AI, first, there's going to be a ton of patient experience gaps. So, delayed responses, and that can be in the form of if you have a mid-level provider or someone that's new to the clinic and you have one person in the clinic that's kind of on the hook for all the outcomes, when there's questions that come up, they're going to have to either pull you out of the treatment room, they're going to tell the patient, hey, we'll get back to you, we'll do these things. That delayed response is going to take you away from being able to get to the next patient. It's going to create poor follow-up habits, right? Which is poor follow-up is going to lead to patients coming in less frequently, and less frequently means less treatments being performed, which in turn leads to less dollars. Lack of personalization, right? You don't want to be that clinic that is known for just running the same treatments on every single person, right? Taking patients, changing, making yourself instead of if we look at the extremes out there of the online retailers that the big players that we all know, there's no personalization there. And so there's this huge influx of patients who have tried to go that route, who are frustrated, they're disappointed, and they want personalized care. If you can create that in your clinic, you're going to become someone who's sought after in your area. Then you have operational efficiencies, right? What does the manual outreach look like in your practice? Are you spending time and time, again, going over, the same administrative tasks? Who's reaching out to the patients? Who's scheduling follow-up? Who's checking when they're due for their next set of labs? Who's reviewing those labs? There's so much time that goes into getting a patient, started versus having them have a successful outcome 6 months down the road. That takes so much time. It's naturally going to create bottlenecks in the clinic, right? And that bottleneck could be you because right now you're the person who's the face of the brand and the person that everyone's looking to for answers. And you can only be in so many places at once, seeing one patient at a time. And that creates, time lost, seeing more patients and also, giving people confidence to kind of grow in their own right. So you don't want to waste time. You don't want to create bottlenecks. You don't want to have manual outreach. And then, the worst thing is revenue leakage, right? Missed appointments, patients not coming back to you, patients starting on a GLP-1 but not getting on their second, third, fourth month, people not getting put into the right cross-sell or upsell on treatment plans. If you have someone who comes to you looking for hormone replacement therapy, but they're mentioning concerns about libido or any number of challenges, those are other opportunities for you to present to them treatments and capitalize from a revenue perspective, but also help that patient get the most desirable outcome. So it really comes down to, when you're looking at your clinic, that first prescription, it really doesn't matter. And I'm not saying it doesn't matter to getting the patient started, but in terms of the value of your clinic and the value of that patient, month 6 is really where if you have a patient who's coming to you not just once, but they're coming to you 2, 3, 4, 5, 6 months, what is the value of that to your clinic? And really putting that into a number so you can see. And what I did was I took, just an average GLP-1 program, pretty conservative amount that someone would be spending on a GLP-1 in your clinic. If you had 30 patients paying you $400 a month that you kept in your practice, just 2 months longer, that's an extra $25,000 in annual revenue on 30 patients that are staying 2 months 2 months longer than they normally would. Imagine all the other stuff that you're looking, all the revenue opportunities that you're losing by not getting them in. So I don't think that there's a question. Everyone wants to have protocols, but what's holding you back, right? Knowledge lives in your head. This is probably the biggest thing that we see. Your expertise, as the ones on this call, is really ultimately the one driving results. but that makes it difficult to scale without systems in place. It also makes it extremely difficult to create that consistency. As your team grows, as you reach the maximum amount of time that you're able to spend with patients, maintaining that same experience that you've created for each patient that comes through the door becomes a challenge. That can't happen. You need to create that standard and stick to it. Consults, program enrollment, right? We're not necessarily trained as clinicians. We're not trained in sales, which can make patient decisions harder. How do we take that information that we have in the patients that we know they would benefit from and get them to a place where the patients can see that and allow them to make their own decisions, but always, push from clinical guidance and clinical expertise. So this is where we combine protocols and AI to take that next step. Proven protocols and AI is going to equal scalable precision care, the foundation for safe, predictable, and personalized outcomes. Why do protocols matter? Well, we know that consistency, improve patient outcomes, reduce the risk of error, efficient workflows, scalable systems. But we don't want to lose safety. We don't want to have unpredictable results. We don't want care that's not personalized to the patients. We don't want to lose provider confidence, and we know we need to have patient satisfaction. And so, how do we create wow level programs with AI? You should find a system that allows you to take that knowledge that's living in your head, upload that, all the things that you know that you would say to a patient when they ask this, you say that, combining different therapies, having dynamic optimization, which allows you to track patients, make changes on the fly so that no one's stuck in one program, and create clarity amongst patients so that they understand the plan and understand the results and also manage to those expectations. So we can move from selling services to outcome-based programs. Here's how clinics are winning using the AI engine. Creating precision treatment plans, right now, if you're not using AI, that's probably something by the time that you review intake, review a patient's labs, understand their goals, go through the risks or possible contraindications associated with it, and then design a plan. That's something that's going to take you maybe 1 to 2 hours. AI can help you do that in a matter of minutes. So you can spend more time with patients and less time on paperwork. That's going to create the opportunity to give you efficiency that scales. So you're spending less time prepping for patients, which is also going to let you have more time with patients. You'll have faster staff onboarding. So if you add new team members, both on the clinical side or the admin side, everyone's going to be producing right away. And instead of their knowledge leaving with people when they go to another clinic or they go to another business or they decide to do whatever and step away from the practice, that knowledge can now stay in the practice and transition to the next person. So there's less disruption when you're inevitably going to lose staff members, right? We know that staff turnover is something that we all see. Creating systems for the next person is going to make sure that if the patient's halfway through their care plan, there's not going to be any disruption there. And so how do we create the perfect mix with better outcomes? Optimal therapy combination, right? So it's not just about one treatment. There's potentially times when they're going to need 3, 4, or 5 different things. We don't want to overtreat, right? That's a challenge in some practices, right? You want to do so much, but that's always not the best thing. And you also don't want to undertreat. And so finding that right balance for patients on an individual basis, that'll lead to better patient adherence. Again, so people are going to follow along. If you're able to present to them a plan that outlines what they're going to look at in the first 30, 60, 90 days, the chances that they're going to stick to that is significantly higher. And then this is going to impact your revenue because you'll see consult conversion rates go up to, maybe 50% higher than they are right now. Per patient revenue will go up with greater programs. So if you're creating people that are right now coming in and they're only spending $400, you should be able to get half of those patients spending $600, $700, $800 when you present that information correctly. And then obviously it's going to keep people coming back and forth much longer. So to do these things, right, you might be thinking, well, I can do some of that in my current EMR. Here's why traditional programs aren't enough. And by traditional programs, you're talking your practice management systems that you've been using that were designed 10, 15, 20 years ago in some instances. EMRs naturally they're built for documentation, right? They're storing your history. They're great tools. You have to have it. Obviously, you need to go back and work through it. It's more of a requirement when you're looking at insurance, but the focus is more so on the documents and less on the patient care. They're definitely not designed for revenue growth, right? So it's providing the what, but it's missing how do we get patients there versus incorporating AI, where you have an AI-driven clinical ecosystem. This is going to be designed for your practice operations. What do you do? It's built around the workflows that you've established in your practice. So you're designing systems for you naturally, just based on how you work in your day to day. There's going to be higher revenue architecture, right? When you incorporate AI, you're going to find more upsell opportunities, more cross-sell opportunities based on what you're doing in the clinic. It's going to create standardization around all of the providers, so everyone's getting that consistent conversation. It's going to improve patient outcomes and experiences. And so I think most people are already using AI, but here's something that you also need to understand. Not all AI is built for healthcare. So if you're using open source platforms, ChatGPT, Claude, any number of ones that you might have a preference to, a lot of those solutions aren't enough for you either because they're not built for clinical workflows. They're not compliant by design, right? So there's no verified clinical sourcing in there. You have high risk of data exposure, so it's not HIPAA compliant. And so these open source platforms, we all use it. I use ChatGPT for a number of things, but when you look at a clinical setting, it really isn't set up for you to be able to use that and for you to be able to use that confidently versus if you create your own non-contaminated environment, with your own AI, it's going to be built for your practice. It is going to be HIPAA compliant, so you don't have to be kind of loosey-goosey with how you're talking about it or withholding important information to help get a better output. You can freely communicate with your AI like it's a member of your practice. Everything is going to be evidence-based, right? So you can ensure consistent clinical delivery at scale, right? We all know ChatGPT hallucinates. There's probably only two or three topics in the world that I would consider myself an expert on, and those few I like to test. And there are many occasions where AI, ChatGPT, is just flat out wrong, right? So you have to be mindful of hallucinations. You need to find a platform that's SOC 2 encrypted, right? So encryption at the bank level so that your data is secure. There's no risk of exposure of your patients. And even, and I encourage anyone to go do this on your own, but this is from ChatGPT. And in the prompt, how should clinicians and wellness providers handle their client information and AI? And it'll tell you basically you can't use this, right? You need to keep your PHI in secure environments. Client data should only live in HIPAA compliant or encrypted systems designed for healthcare. Use public AI for general knowledge, but don't use it for patient records, right? Meaning don't upload a set of patients' labs and have that review that for you. That is a public tool. And once you put that information out in the domain, pretty much anyone can access that. And so I'm not trying to scare anyone, but you really should be careful as to how are you interacting with these different platforms. So with that, I want to give you guys some real life scenarios as to how can you use AI in your clinic and what can that actually look like, right? So you should be able to take a patient's intake medical information and create a rapid patient assessment. It should not take you an hour to read through a patient's intake to get to a place where okay, this person is a candidate for a GLP-1. We're going to also recommend to them hormone replacement therapy, and maybe there's a few peptides that they can benefit from. That should not take you an hour and a half. It shouldn't take you longer than a couple minutes to interpret labs, right? This should be tasks that are taking minutes, not hours, right? We know what we're looking for in the labs. If you can set your normative values and ranges for different tests that you're constantly running, AI should be able to give you that result, but it should be based on what you think are normative values, no one else. It's there, you have your own expert opinion, and that should be applied uh, to your patients. Create precision treatment plans, tailor it to those needs. None of these things that are probably taking you guys a lot of time right now should take you longer than 5, 10 minutes. Create consistency with patient communication, right? Having one platform that all of your results and all of your infrastructure lives and be able to have anyone who comes to your clinic, both on the patient and the staff side, looking and seeing the same thing. So, what my goal for everyone on this call, and it doesn't matter what platforms you use, right? You can go find some, but we all know how long and how much medical information we're taking in to figure out what patients need. We've seen screens that have 200 questions. What is this? Half the time the answer is no. You should go from screens of intake forms, screens of lab tests and results, and all of these things that you have to go through. And these can be 20-page reports. You should be able to go from this to something that takes your protocols that you can establish. What are we looking at from a lab perspective? What is your critical range, right? When someone's estradiol comes in and you're looking at that, if it's well within your optimal range, you shouldn't have to spend a lot of time thinking about that. Whereas if it's critical, you need to do something about that right away. Maybe there's things that we need to monitor that don't require information, but whether it's you reviewing this or whoever, asking, being able to ask questions. What we want to allow people to, this is, your own version of ChatGPT, your own version of Claude, but it's trained by you so that when you have a question about the status of your patient, the lab results, the biomarker trends, you don't want responses that come from all over the place that you haven't been able to test. There's no evidence behind. That should be your voice, right? And so being able to quickly review labs, have something where if you have someone send you scans, in-body scans, which I mean, we just spent an hour talking about how amazing the insight into the patients are on there. Someone's got to read those reports. You should be able to apply AI to summarize that, bring your attention to key risks and benefits and all the things that you're doing in the clinic, and then score those patients and match them with protocols in your office so that you can then present that to them, right? So creating summaries of documents so that instead of going through 20 pages, you're going through a paragraph that has all the highlights in it. And finally, ending with, hey, Sarah, here's your plan, right? Specific to the patient. Create an assessment, review the intake, review the labs, welcome Sarah to the clinic, match her with programs that make sense, what you discussed, 90-day goals, what can they expect? All the things that you want to do in your clinic right now that's taking hours should take you a few minutes. So um, that is it for my presentation. Again, if you guys have questions on anything as it relates to AI, protocols, peptides, GLP-1s, we're happy to have a conversation. My contact information's here. You can scan this QR code to, um, give us your information. We have a full team, so anyone would be happy to meet with you based on wherever you are in the world. I know I'm here on the East Coast, but most of the folks are on the West Coast, so you can fill out that code. We have tons of great promotions through the for anyone attending the MedBio live. And if you watch on demand, don't worry, we'll make sure that you get access to our special offers. We have a bunch of different plans so we can try to map something out around your clinic. And like I said, even if you just have questions about AI, we're happy to have those conversations as well.
Yes, thank you. Thank you so much. This was great. I think it's so incredible what AI is able to do today, let alone, what is coming in the future. Um, Actually, and so, one question I have is like, I think AI is incredible. However, it can also be very overwhelming. And so I think a lot of times it's like there's now so many different AI tools out there. It's like which one to use, why to use them. And then sometimes
Sure.
it gets to a point where you're just a little bit stuck. And so, specifically for clinics, like, a clinic that, like, let's say doesn't utilize AI versus one that does, where do you think they're going to be a year from now?
I mean, depending on what your definition of using AI is, I think we're probably at the point now where everyone is using AI and it's more a question they're asking themselves, how do I really maximize what I can do with AI without losing, what we're doing in the clinic? So I think, practices who are already super into AI are going to find more ways to use it a year. I tell everyone, and it's not just healthcare, but if you're not going to incorporate AI into your life, you're going to get passed by your competition. You're going to get passed by, you know, anyone else who's looking to do something or be in a similar field to you. So if you're not using AI, you need to find a tool that works for you that, makes your life. Just ask yourself if you had five things in a day that you didn't have to do anymore, or
Yeah.
that you could find a companion to do it for you, go find a solution that does that and
Right.
that start there.
Yeah. Yeah. No, I was saying actually I was working on some things a couple of days ago and it's like I think what I would have been able to get done in 5 days, you can get done in one day just because there's so many different, tools and workflows and it's like I think what you guys have built is incredible because it's one of the questions we get a lot from clinicians is specifically around building protocols. And how to use patient data to build them. And, there's tons of different, like we even have with MedBio, it's like predetermined different protocol stacks that you can offer your patient, but it's like it's actually creating the custom ones that are built
Yeah.
from their test results that end up being so important.
Yeah. Well, and if you can prove that your protocols actually get better outcomes, you're going to put yourself in a much different category
Yeah.
of a clinic than those who don't aren't able to make those claims.
Right, right. And then we have some questions in the chat. If you guys have more, please keep dropping them in. How often does the evidence-based information update within your AI system that you're offering?
Constantly, it never stops.
Okay.
It, it,
And
it
then
never
there's questions
stops.
on cost.
Yeah, so we have, and these are great questions. So we have a couple different layers of intelligence. So we've actually, and we talk a lot about protocols. We've actually built out. We have protocols that we can provide to you. So that falls under our core intelligence model, depending on what protocols you're looking for, what you do in the clinic. Most practices are spending around $500 a month to utilize faster outcomes. But then if you're a clinic who's sitting there and you're saying, wow, I want to use a tool like this, but we do things much differently than anyone else around us, the treatments that we have the way that we're incorporating, uh, you know, these treatment plans and what we do. I don't want to use anyone else's protocols. I don't want to do this. We can create a fully customized, unique experience for just your clinic. Your data is protected, your protocols are protected. No one else can see that. It doesn't train the AI for other clinics who are using it. It's just specific to your practice. Again, not contaminated, SOC 2 encrypted. Um, that's a custom level of build depending on how many protocols and how many documents that you have. But for most of our practices, they're spending between $500 and $600 a month.
Okay. And we also have the QR code that Chad had pulled up and all the details on the special offers that they're offering specifically for MedBio and for attendees. All that information is also in the playbook. So definitely check that out, book a demo with them. Yeah, I think this is an incredible tool. When I first met with you guys, I was, it's definitely, I think it's going to be a huge help to clinics as they scale their businesses.
We certainly hope so. So thanks for having us on, letting us talk about it. And if anyone has questions, that's my cell phone. So the best way to reach me is always by text. So if you want to send me a text, but you can email, call, whatever works for you guys.
Okay. Well, that sounds great. Well, thank you so much for joining us today.
Yeah.
And yes, everyone just give us a couple of minutes and we will get transitioned over to the next session.